There's a conversation every man over 60 should have already had, but most never do. Not in the doctor's office, not in casual talks with friends, not even in those quiet late night moments when concern quietly shows up. It's a direct, serious, and necessary conversation about prostate health. Because the truth is, small daily habits can make the difference between dignity and discomfort, between restful nights and constant trips to the bathroom, between living freely and feeling restricted by your own body. I'm Dr. Sofia, a urologist with nearly a decade of clinical experience helping men protect and improve their prostate health. And today, I want to walk you through 5 simple, natural habits that can make a real difference after age 60. One of these may surprise you, and most men underestimate its impact until they actually start doing it. Before we begin, if this topic matters to you or someone you care about, take a moment to like, share, and subscribe so more men can benefit from this conversation. And stay with me until the end, because I'll also give you a simple step-by-step way to start tonight. Many men assume urinary changes, slow flow, weak stream, frequent nighttime urination are just part of aging, but that's only partially true. Yes, the prostate naturally tends to enlarge with age, a condition known as benign prostatic hyperplasia, or BPH. By age 60, more than half of men show signs of it, and by 70, that number can rise above 80%. But enlargement does not automatically mean suffering. The severity of symptoms is heavily influenced by daily habits, inflammation levels, circulation, hydration patterns, and lifestyle choices. Over the years, I've seen countless men who believed their best years were behind them regain comfort and control, not through complex treatments, but through consistent, science-supported habits. That's why I want you to think of this as a private conversation, not a lecture. If you were sitting in my clinic, this is exactly what I would tell you. Let's begin. The first habit is strategic hydration, drinking smart, not just drinking more. Most men unknowingly work against their own bladder. They go long hours without water in the morning, then drink very little during the day, and finally consume large amounts in the evening. The result? Frequent nighttime urination and disrupted sleep. As we age, the body's thirst signals become weaker, and the bladder becomes more sensitive. When urine becomes concentrated, it irritates the bladder lining and increases urgency and discomfort. Strategic hydration means sipping water steadily throughout the day, especially in the morning and early afternoon, when the body is active and can process fluids efficiently. Then, in the evening, fluid intake should naturally decrease. This simple adjustment helps reduce nighttime pressure on the bladder and allows deeper, uninterrupted sleep. The second habit is a light walk after meals. Circulation is one of the most underrated tools for prostate health. Sitting for long periods after eating slows blood flow and can increase inflammation in the pelvic region. A simple 10 to 15-minute walk after lunch or dinner can significantly improve circulation, support healthy metabolism, and reduce pressure in the lower urinary tract. Research has shown that men who maintain light post-meal activity experience fewer urinary symptoms and better overall metabolic health. But beyond the science, there's something more meaningful here: freedom. The ability to enjoy a walk after dinner instead of planning your life around bathroom visits is a powerful shift in quality of life. The third habit is regular sexual activity or ejaculation, which acts as a natural maintenance function for the prostate. The prostate continuously produces fluid, and when that fluid builds up without regular release, it can contribute to inflammation and discomfort. Ejaculation helps clear stagnant fluid and supports healthy prostate function. Large long-term studies have shown that men with more frequent ejaculation tend to have lower risks of prostate-related complications. Beyond the biological effects, intimacy also supports emotional well-being, reduces stress hormones, and improves circulation. It is a natural, healthy part of male physiology and should not be ignored or stigmatized. If challenges exist in this area, discussing them with a healthcare professional can provide safe solutions. The fourth habit is strategic eating, using food as preventive support for the prostate. Certain nutrients have been shown to support prostate health and reduce inflammation. Lycopene, found in cooked tomatoes and tomato-based foods, supports cellular protection. Zinc, found in pumpkin seeds, nuts, and seafood, plays a key role in hormonal balance and prostate function. Cruciferous vegetables like broccoli and cabbage support the body's natural detoxification processes. Men who consistently include these foods in their diet tend to have better long-term prostate health outcomes. This isn't about strict dieting, it's about consistent, supportive nutrition that reduces internal stress on the body and promotes balance. The fifth habit is deep, restorative sleep. Sleep is when the body repairs itself, regulates hormones, and reduces inflammation. Poor sleep is strongly linked to worsening urinary symptoms and overall prostate discomfort. During deep sleep, the body releases important recovery hormones that support tissue repair and immune balance. On the other hand, disrupted or shallow sleep increases inflammation and can worsen urinary frequency at night, creating a cycle that becomes harder to break over time. Supporting sleep means maintaining a consistent bedtime, keeping the room dark and cool, and avoiding excessive fluids right before bed. When these 5 habits come together, hydration, walking, sexual health, nutrition, and sleep, the effect is not just additive, it's synergistic. Each one supports the other, gradually reducing inflammation, improving circulation, and restoring better urinary control and overall comfort. And if you're thinking, is it too late for me? The answer is no. It is never too late. I've seen men in their 70s and even 80s experience meaningful improvements simply by adopting these consistent daily changes. The body has a remarkable ability to respond when given the right conditions. Start small. Choose one habit today. Practice it consistently for a week. Then add another. Progress is built through repetition, not perfection. Your 60s, 70s, and beyond do not have to be defined by limitation. They can be years of freedom, energy, and confidence if you take control of the habits that shape your health every day. If this message resonated with you, share it with someone who needs to hear it, and subscribe for more conversations that most men never get, but absolutely should. I'm Dr. Sofia, and I want you to remember this. Your health is not left to chance. It is shaped by your daily choices, and the best time to take control is always now.